Hi, this is Dr. Vinton, and welcome to this short video. Now, one of our physicians will be returning your call this evening after 7 when they're finished seeing patients. Because they'll have 15 or 20 phone calls to return, this video is designed to answer the few basic questions that everybody seems to ask so that we can better maximize your use of the time when you have the doctor on the telephone. So the first question everyone asks is, who are we? Well, we are the Pain Relief and Wellness Strategy Center. We are a premier medical center with physicians, pain management specialists, surgeons, chiropractors under one roof. As a result, we have tools and technologies that go far beyond the standard for a joint issue, cortisone, physical therapy, gel shots, or God forbid, surgery. Now, there is a time and a place for surgery, but most people don't realize that a joint replacement surgery of the knee or a shoulder is a 50-50 proposition. Half go well, half don't go so well. In fact, the science tells us that about half the people still experience pain of a 4 to a 6 every day, and they have limited mobility. And that's if they don't get the side effects of the blood clot, which can be life-threatening, or the infection, which can last days, weeks, months. I've even seen it last years and end up in an amputation. So the reason that we do what it is that we do, the reason that we spent the last 37 years putting together the most comprehensive program in the country to help people get out of pain, but also to avoid a joint replacement, it's called the Vinton method. It's a trademark method that our doctors have put together over the last 37 years. And we have 12 to 15 non-surgical solutions. So far beyond the standard cortisone, which if you don't know, your doctor should have told you, every shot of cortisone accelerates the arthritis. In fact, based on MRI studies, every shot of cortisone, you can see accelerated damage on a follow-up MRI, forcing a person into a joint replacement situation sooner. Gel shots, which work incredibly well for very early stage arthritis, but middle to late stage, it doesn't work very well. In fact, most people who are in the late stage who've had it says it didn't even last a week. So that's why we put together. See, as long as a person can still move their joint, they can still extend their leg, or it lays flat on the mattress, or flat on their favorite chair when they're watching television in the evening. As long as you can still move that joint, and we get it, it might hurt, but this is a mobility test. As long as you can still move it, you absolutely have options besides having a surgery. Now, some of our options will last a few months. Some of our options will last many decades. So when we do our evaluation, which is an hour-long evaluation, we look at the 5 comorbidities, or the 5 things that could cause, in addition to arthritis, knee-related or shoulder-related or hip-related problems. The first are mechanical injuries, so blunt force trauma, car accidents, sporting accident injuries, those sorts of things that begin the degenerative process. There are tools that can temporarily or more permanently help reverse that situation without surgery. We also look at the kneecap. Over 70% of the patients that we see and examine and take x-rays of in the standing position will find the kneecap not sitting in the patellar groove. That alone can cause wearing behind the kneecap, causing osteoarthritis. And even if the joint of the knee itself is fine, that kneecap alone can cause fairly intense and debilitating knee pain. We also know that lumbar stenosis, nerve holes closing up with or without, and usually without back pain. But the number one effect is people feel throbbing knee pain. So we look at that as a potential generator for pain. We also look at leg length inequality. 92% of individuals, when their x-rays are measured by x-ray and then measured with a digital ruler, have one leg a little longer than the other. And that imbalance over the course of a lifetime just causes accelerated wear. And if not corrected at the same time the damage to the knee is corrected, will lead to future problems. We also look at the arches of the feet. 85% of patients, when they have a 3D laser scan of their feet, show a dropped arch. And every time they walk throughout their lifetime, there's just this gentle dropping of the arch, which causes a gentle buckling of the knee joint or hip joint and can cause it to wear out prematurely. And again, if not also corrected, regardless of what you do to the joint, even if it is a knee replacement, you'll have further trouble down the line because it was a causative factor. And the last reason, the fifth reason, are metabolic, inflammatory reasons, right? We do blood tests that are 3 to 6 times more in depth than what your family physician might look at. So when we look at the totality of all that, and we have 12 to 15 non-surgical options that can help every stage of osteoarthritis, except for the person who can no longer move their joint. So if you're at the stage, regardless of discomfort, if that knee will no longer lay flat, or if you can no longer extend it out in front of you, unfortunately, we're not able to help. But if you can still move that joint, then our office is the first place you should look for short and long-term solutions so that you can help avoid having that joint replacement surgery. So we've been at this location in Grove City for the past 37 years. We have 6 physicians, medical physicians, pain management, surgeons, chiropractors, all under one roof, all working together. And we've put together these 12 to 15 options, everything from simple injections to specific therapies to something called soft wave therapy. Stem cells are a big part as well to help regenerate the joint. There are 12 to 15 options that we're able to help patients with to, again, relieve their problem short and long term and help them avoid a joint replacement. So tonight after 7, when our physicians are finished with their seeing their regular patients, one of our physicians will reach out. Hopefully this video of understanding just a bit about who we are, some of what it is that we do, roughly where we're located in Grove City, and we're easy to get to. Half of our practice comes from the Pittsburgh area. The other half comes from out of state. Every day, I'd say half of our patients are from another state, whether they drove in or flew in or had to make special arrangements. We do have a group that can pick you up at the airport or take you to a train station. We do have special discounts with local hotels to help in that regard. And we do understand, so when we schedule your evaluation, we typically schedule them on a Thursday, but more ideally on a Friday, so that those who would like to receive care could actually have their first treatment right then and there, thus saving them any of future or additional trips. So we've thought of all of this in advance. We put together a premier center that is 5-star from start to finish. We put together a team of physicians with over 200 years of combined experience in helping patients relieve their pain and avoid a potential risky surgery. And understand there are times, 1 to 4% of the time, that a surgery, there's no other option. But again, our experience has been if you can still move that joint, even if it hurts terribly so, even if it creaks or cracks, then we're able to help. We hope this short video and some of the other videos on this page will help answer some of the basic questions that you have. So again, when the physician calls you this evening between 7 and 8:30, and again, they're going to have between 15 and 20 phone calls to make this evening, but watching some of these very short videos will give you a reasonable understanding of some of what it is that we do, why it is that we're unique, and why people travel from all over the country to visit us at our Grove City office to receive care and help them get back to doing the things they love doing most. We look forward to talking to you this evening.